Hello, my name is Clinton Lewis. Today I will be doing my presentation over my disease project. I have chosen rubella. Rubella is a virus, also known as the German measles. It is part of the genus Rubivirus and the family Togaviridae. So the life cycle and structure of rubella. Rubella is a spherical virus that is enveloped. It has glycoprotein spikes on the outermost layer. These spikes are how the virus finds, attaches to, and enters the cell. Once the virus has found a host cell, the virus will attach using the spikes, and then the cell will do a form of endocytosis to bring in the virus. Once inside, the virus will lay latent until the pH and calcium levels are at an optimum amount or level for the virus to bud. This budding releases the viral RNA and proteins of the rubella virus. These proteins and RNA travel to the endoplasmic reticulum, where they use the ribosomes of the ER as a way to replicate themselves and form new copies. Once these new copies have been formed, they are transported to the Golgi complex from the ER. Here in the Golgi complex, they are packaged, built, and assembled into immature versions of the virus. Once these immature viruses have been formed, they are released towards the exterior of the cell. On their journey to the exterior is when they become mature. And once they have reached the exterior, they are released as fully formed rubella virus particles. Rubella virus is very hard to replicate in the lab because it requires living cells. It can be formed in some cell cultures in the lab, although since it is a virus, it is very hard to do so. Moving on to the transmission and mechanisms of disease. Rubella is mostly airborne through sneezing or coughing. It can also be spread by saliva, however, going back on the sneezing, and by sharing food or drink. And then lastly, to its most problematic form of transmission is from mother to unborn child. The mother can unknowingly give it to her child if she has the virus, and this is where it has its biggest effects. Now, moving on to how it causes the disease. It is a virus. It does invade cells and change their natural functions. These unnatural changes are how the virus causes some of its symptoms. This, coupled with the body and its natural responses to fighting off the virus, are what causes the symptoms. Now we're moving on to symptoms and diagnosis. Some of these symptoms include headache, fever, lymph nodes may be swollen, and lastly, the most notable is the rash that forms at the head and goes down the entire length of the body. These are all mild symptoms. You may take some anti-inflammatory, anti-headache medicine, but the most severe are the teratogenic effects that it has when it is spread from mother to child in the womb. These effects can range from full organ systems to just vision, hearing, and they're lifelong. It leads to cell death and the immature cells being formed because the virus is invading cells and it's changing their normal functions as they develop in the embryo in the baby. And this leads to the teratogenic effects. So the diagnosis, the virus is diagnosed through blood work. This blood is screened, the patient's blood is screened for antibodies against the virus. This shows that the patient either had the virus or has had the virus and has either fought it off or is in the process of going against the virus. It can also show if an antibody is still present or if a vaccine is still present because of the antibodies from the vaccine. Now moving on to treatment and prevention. Unfortunately, there is no treatment for rubella. It is something you just recover from on your own since the symptoms are really mild. Moving back to the teratogenic effects, Mothers who are pregnant or plan on being pregnant are recommended to get the MMR virus and stay away from anybody who may suspect it to have rubella because of the effects it can have on their children or their child. Now moving on to prevention. As I mentioned, there's the MMR vaccine. This vaccine is for measles, mumps, and rubella. It is given to children at a very young age. And this vaccine works as any other vaccine does by putting a weaker version of the virus inside the body. This allows the body to build up an immunity and build up antibodies against the virus itself. These antibodies can be screened in blood work. This is to determine if they have the vaccine or if they've had the virus, of course. But this vaccine allows for a safer way for a person to build antibodies rather than just getting sick and having to deal with the symptoms and that sort of thing. And this will conclude my presentation of rubella.